Hi, this is Chuck Brooks with Extreme Networks. I am the Ecosystem Solution Architecture, and I'm here with Ali Youssef. And we're going to talk today about managing the increased cybersecurity risk and securing your airspace during this unprecedented time. So with cybersecurity in general, we're seeing a lot more activity. And while people are focused on COVID-19 and how we're going to treat the people, how we're really going to drive some of the pieces with regards to vaccines and treatments and therapies, we're seeing a lot of people actually trying to take advantage of that, and we're seeing hackers running through and delivering bogus emails, malware. Today I actually saw another virus that's transmitted via the email, and it basically overwrites the master boot records of your computers, making your computer basically unusable. So we've seen a big increase in that. And Ali, I know you've actually seen some that have come, from very respected people throughout the different organizations you're a part of.
Yes, Chuck, it's interesting. We're seeing some of the best in people as this is unfolding, with charity and people trying to be of service. And then we're also seeing some of the worst qualities in people. So I experienced something, a phishing email pertaining to Stanford University. And this email was sent to me from a family member, from a physician, and then from another friend that's also a physician in a different health system. And they framed it as, a legitimate email where they knew someone at Stanford and they were trying to provide, advice around COVID-19. And some of it was, fairly relevant. Much of it was bogus. But the interesting piece is, there was a URL implanted at the end that was essentially the phishing attack. And this was circulated to the point where Stanford went out on their Twitter account and essentially notified the world that, this is not coming from their institution.
Yeah, it's kind of amazing that when we see, all the people trying to do good in the world and trying to come together, that while these new technologies are coming forward, think about the Zoom product, which, we actually do use, but they have that Zoom bombing now where people are able to crash in. Now, I've already seen that Zoom was trying to fix that and bring in their security force to drive that, but with some of the lax or the relaxed standards based on telecommunications for, telemedicine and driving those pieces, that security piece is kind of getting a little bit more lax to allow the flexibility, but now people are trying to take advantage of those types of things. And that's kind of what we want to talk about today here. Some of the things that we're seeing a huge uptick in with the treatment of patients at this critical time, remote and teleworkers. Any business that is really forcing its workers to work from home if they can. I know our company is actually doing some of that, where people are still in the labs, but they're kind of rotating shifts. They're trying to drive around some of those things for anybody that has to be in the office. You're seeing cities and states putting up triage tents. I know Detroit has that. New York has that down in Central Park. They're using some of the Navy ships as temporary hospitals. And then even, I know down in Fort Lauderdale, where I am, you have the temporary hospitals going in for some of the cruise ships. So you have that piece where people are unfamiliar with, maybe their surroundings and their infrastructure. But then you also have the overburdening of the existing hospitals, where we're trying to treat as many patients as we can. We're moving people into the different rooms. Maybe they're stacking extra people in areas that are not usually handling patients. So we have a lot of those types of things going on right now. And that's what we're here to talk about today. So myself, I've been a teleworker for several years now. And some of the things that I'm used to working from home is the flexibility of being able to do things. I have a lab in my house, so I do a lot of different testing and things like that for our products. Well, now that I have a wife at home that's working from home, I have kids that are doing remote learning, a lot of those type of things. Now I actually have to wait to do my upgrades in networks. I need a maintenance window for my own home, which is kind of crazy when you think about it, because, you know, everybody's on there and we're fighting for the bandwidth. So we're trying to do some of those things. So what some of the things that we've done here, and, you know, you can jump in at any time, Ali, but we've tried to break out some of these things with separate SSIDs. So I try and keep my work on a separate SSID as the Xbox and all that type of things. And same thing for the kids for the remote learning. You have to have that. You need secure passwords for each of those SSIDs too, because you don't want you know, some of your communications going over an open channel. And now with your neighbors probably having open networks, possibly your computer can jump to those with you out even knowing about it. So things like that, prioritizing the traffic, if you can. I mean, I'm a little bit probably lucky with regards to this, working for a networking company. I can partition my network so that I'm on separate VLANs. Not all the consumer grade routers that you may have from your providers can support that type of thing, but it's just something to consider as you're moving forward. Other things to worry about is the VPN itself. You need to make sure that VPN connections are staying up. They're not getting dropped, you know, after certain time frames. And then again, you also have the phishing attacks that we mentioned earlier, that Ali mentioned. You have to make sure if you're using your home computer to connect up to corporate, that you're not going to infect the corporate by opening up an email from your personal accounts. So those are some of the things that we've seen with the remote and the teleworker cases. I know we've tried to put together some packages for people to be able to drive this, both internally and externally for our customers. So,
and Chuck, I just wanted to add, it's not a typical teleworking arrangement like you mentioned. I mean, you have the whole family is quarantined to try to comply with this guidance. And in some cases, so in my case, you know, I work for one health system, my wife works for a different health system. So she's having to do telemedicine visits on the same network that everyone else is relying on. So if you do have the capability to set up separate VLANs, I mean, it's definitely, this is a time to do it.
Time to redesign the home network, so to speak, if you can.
Yes.
Yep. So the other piece, and we'll kind of get into this a little bit, and this is really where you're coming from, because Ali, you're living this right now, right? You're dealing with a lot of the things with regards to your hospital and triage tents and temporary hospital sites. So if you could maybe kind of explain a little bit what you're seeing, and hopefully, you know, you can kind of guide some people as to what you're seeing as best practices, even though I'm sure with this crisis, some of those best practices aren't followed necessarily step by step, just because of the severity of the situation and the criticality of it.
Sure, Chuck. So like you mentioned earlier, you know, healthcare IT is getting overwhelmed with, you know, requests for teleworking. And really, this is the second major request is this notion of having tents that you're able to use to triage and test patients that could potentially have COVID-19. And then really the third scenario is having additional beds, some vicinity away from the hospital. In some cases, it's close. In other cases, you know, relying on convention centers. So when it comes to the first case, which is the triage testing tents, there are some things to keep in mind. I mean, you really want to take the simplest approach to provide connectivity. And so the approach that we've taken towards that is we rely primarily, if there's enough Wi-Fi bleed from the healthcare facility and the tent is, you know, less than 100 feet away, then we'll use that primarily. If there's the opportunity to run a cable, you know, less than 300 feet back to a local IDF, we'll take that approach and actually install a wired switch in the tent. And then really after that, the scenarios after that have to do with setting up, you know, wireless bridges and mesh networks. And you can extend those to be, you know, several hundred feet away from the facility, depending on the types of antennas that you use. And then really last but not least is this notion of having, you know, a network in a box set up. And that's really more relevant for once you start setting up tents that are further away from your facility, you know, that's a standalone network that the clinicians can use to connect back to the hospital. So, you know, some things that we're dealing with there, you know, number one is security. If you can extend your current network security best practices over to the tents, that's best case scenario. And when you see some of the shortcuts, that some of the government institutions are taking now with their guidance, it's easy to jump to a conclusion where, hey, let's cut some corners and maybe not use the appropriate type of authentication or encryption in these scenarios. But I think it's really important to try to stick to your best standards and veer away from those types of scenarios. Some of the other things that we're dealing with have to do with, when you're dealing with a tent, it's not a typical IDF, or it's not a typical environment where you would be installing network equipment. So environmentals, appropriate humidity measures, things like that are outside your control. Not to mention being able to disinfect the equipment and having the ability to put it away at the end of a shift so that it doesn't get tampered with or stolen.
So it really becomes, I mean, that's really something that you guys probably, I know you've done some scenarios, disaster type of scenarios, but because of the way this pandemic is playing out, it really has become not just an isolated incident. This is every one of your hospitals that's really having to deal with this type of off-the-cuff solutions to be able to drive this, right? You might have had one or two hospitals in certain areas that you said, okay, this is where we're going to send people in case of some type of an emergency or disaster, but now you're kind of hitting the influx of everybody's showing up, or you're creating these different triage centers at all of your hospitals, not just a couple anymore. So you can't even really divert, maybe possibly you had resources that you had, I'll call it in the closet for your IT networking, for your medical equipment, but you also expected to be able to shift some staff over to there, whereas now you're all those things have to cover every one of your campuses and those new temporary solutions that you guys are putting up.
Yeah, that's absolutely right. And we've had to ramp up to the point where, we have enough equipment now in order to stand up anywhere between 20 to 30 tents in the near future, because we don't know how fast. Detroit is a hot zone right now, and we don't know how fast these demands are going to be coming at us. So the closer you can get your setup to a cookie cutter approach, I think the better shape you'll be in.
So that brings up our next piece of this, which is really the challenge for the existing hospitals, where, as we discussed a little bit earlier, of being able to have extra beds in there, right? They're right now, and you tell me, but from what I've seen down here in Florida, they're actually moving patients, for instance, from children's hospital, from normal hospitals over to children's hospitals to clear up some of the ICU beds and things like that, just to be able to take those influx of patients coming in that are going to need those kind of treatments. I mean, we in Florida right now are not quite to the point that Michigan is, but I know, unfortunately, we're going to be getting there, and Florida actually has more of an older or elderly population, which could really be devastating to the overall state itself.
Yep, no, you're absolutely right about that. I mean, different floors in the hospitals are getting repurposed as needed. And really some of the other considerations around that have to do with the naming convention and the EMR setups around the different floors as they're getting repurposed. But then the other really important piece, I think, is, you mentioned guest Wi-Fi. We used to say it's mission critical. Now it's that much more important, because the scenarios we're running into, and you've probably read this in different newspapers, essentially in publications around the country, but we're running into scenarios where nurses are providing their personal phones to a patient so that they can communicate with their loved ones. Because once you're in an isolation scenario, you're cut off from your family. So in some cases, if if your condition deteriorates, it's that much more critical to be able to reach out to family members. So the point I'm trying to make is your guest Wi-Fi infrastructure and setup and how robust it is extremely critical right now.
So that kind of brings up a point that I'm curious about, because now you're dealing with devices that are coming from the National Depot, for instance, medical devices that your biomed or your clinicians that may not be that familiar with. How are you actually looking to keep those from we'll call it wandering onto the guest network or maybe going onto open networks. I mean, do you guys have some kind of, how do you handle those types of things in a normal situation? I know you guys cover it because we've worked with you in the past on some of these things, but can you kind of describe that a little bit?
Sure. Yeah. So under normal circumstances, we do have an onboarding and certification process for our medical devices. So we go through and we evaluate them from a technology standpoint, as well as a security and ongoing operations standpoint. In this particular case, that runway is sort of short, because you're absolutely right. As you're running out of equipment, when it's needed, it's needed. The clinicians are not going to wait for a full security evaluation of every single device type that's coming in. So even though we cannot go through that whole process, I think it's still important to look at device documentation, security documentation from the manufacturer, and do some type of due diligence to ensure that you can at least meet a minimal baseline of security best practices around medical devices. Because the last thing we want to see happen is essentially with these different hacker scenarios, having that impact medical devices directly, it would be my worst nightmare.
Right. So you're really having to work even closer with your biomed departments in order to make sure that security, and basically pulling the MDS2 sheets to be able to kind of at least have some kind of framework to be able to kind of enclose that, or at least cut off some of the security issues that you could possibly have.
That's exactly right.
So, and I think we've kind of covered some of the things with the clinical engineering piece, but I think this is kind of important bullet points that really, as our customers and anybody who's facing this crisis really has to understand. These are some of the things that I know we've talked about before on this. So if you want to just kind of wander through some of these to kind of say what we've been driving towards for this.
Sure, yeah. So one of the key things as new devices are getting introduced is essentially scrutinizing the device and understanding how it's going to integrate into your current infrastructure. Some of the other components are scrutinizing when you look at the MDS2 framework and how a manufacturer is answering those questions. It gives you an idea of how mature their security processes are. So looking at things like security patching, how do they handle that? Is it up to date? And then really the support aspect is becoming crucial, and the training aspect for clinical engineering, because now they're having to pivot and learn about these new devices in a very short period. So it's important to have a help desk or a call center where end users can reach out to in case they have questions about specific devices, and they can reach your clinical engineering department quickly. The other key thing to keep in mind is now we're provisioning. So when you start dealing with things like video, and there are many different use cases now for that within the hospital. One has to do with reaching out to loved ones, where you might be using a consumer grade device and using things like Zoom or WhatsApp, or the list goes on. And then there are scenarios where you need to do telerounding or traditional telemedicine video visits, where you need more robust solutions to provision that. And in a lot of cases, the consumer grade devices don't really cut it as far as the type of quality that they can provide. And then the prioritization aspects as well, right? So some devices will be on your guest network, but others are going to be relying on your internal network. And usually it's a Wi-Fi network. So being able to prioritize the traffic appropriately and making sure that each device is getting the type of quality to provision a good quality of experience in each case is crucial.
So kind of in summary of that, it's really all about, the security has to be tight, so to speak, with regards to the equipment that's being used, all the new equipment that's being onboarded, even some of the guest traffic, things like that. But the problem is it can't be so overbearing that it impedes the overall progress of the treatment of the patients, the clinician's speed to be able to go from patient to patient, and really all the functionality that comes behind of working with the patients in this crisis situation.
Yes, that's exactly right, Chuck. I mean, it's sort of balancing usability with security, because as you know, there's no such thing as true security. I mean, if you want absolute security, then you just don't have a network. That's really the only way to accomplish that, in
Right.
absolute terms.
Unplug everything and then you're secure, right? I mean, that's
Yes.
what it comes down to.
Yes.
So, well, let me just kind of summarize real quick. Extreme Networks is here for our customers, for anybody that needs help with anything. We actually do provide wired and wireless solutions that can be managed on-premise or via the cloud, which gives some flexibility to this current situation that we're in. We have packages that we've put together for remote workers, for hospitals, for clinics, and even the temporary facilities and tents and triage and testing centers that Ali and I were talking about earlier. We also have the security solutions to be able to protect those new medical devices that you may or may not be familiar with, along with products that can overlay into your existing network, such as the air defense, to be able to check for wireless issues, rogue access points, things like that. And then the other piece to this, and this is probably one of the most important things, is that we have a global technical assistance center, our GTAC, which is available 24/7. It's totally insourced, and typically the engineer that you're talking to is going to solve your problem right there versus just opening a ticket and driving that. In these trying times, I hope that we've provided some information that will help you along this journey. So please, in this time, take care, and thank you.